What's going on, world? Welcome. You all already know what the deal is. Y'all already know what we're doing today. Today is Wednesday. NCLEX questions. You already know what the deal is. Hey, you already know what we're doing today. We're doing NCLEX questions. Hey, I want to know who you are, where you're from, where you are at in your nursing journey. This damn thing looks so bright, and I don't understand why. So, like I said, I want to know who you are, where you're from, where you're at in your nursing journey. If you guys are just now new here, we are going to be doing NCLEX questions. Make sure you guys smash that like button, you guys share, and you guys follow. I'm pretty sure a bunch of y'all just saw me inside of Nurse Amber's live. Hey, Nurse Amber is the homie. Just letting y'all know. We go way back like two flats, you know what I'm saying? So, hey, we have a collab coming up real soon. So it's in the works. We're going to be talking about some stuff so we can, since we're both out here in these NCLEX streets, we're both going to bring you something spectacular. But you already know what the deal is. I need 100 people in here and I need 1,000 likes. If I don't got either one of them, y'all don't get these glorious questions that I'm finna drop on y'all. You know what I'm saying? But like I said, smash that like button. Make sure you guys share. Make sure you guys follow. If you're in nursing school right now and you don't share this to Becky with the good hair that you in school with, I don't care how you feel about her. I don't. Just send it to her. What she decides to do with said information is up to Becky with the good hair. So, like I said, I want to know who you are, where you're from, and where you're at in your nursing journey. But hey, until I get what I asked for, what are we doing? What are we really doing? All right, let me see what y'all are talking about in here. Somebody done already said something about I start nursing school May 6th, going to take my T's on Monday. Shout out to you as a Tamia. Hey, you're going to go out there, you're going to rock it. Currently a medical assistant. Shout out to you. Hey, so best way to study for the T's. There's a yellow metrics book that's out there. It was really, really helpful for HESI A2 as well as for the T's. All right. And there's another young lady on here. Her name is Nurse Sam. She does T's and HESI A2 lives every Tuesday. The Nurse Sam, she has pink scrubs on. Can't miss her. All right. But hey, so what else? We got 77 people up in here. Hey, get carpal tunnel for me, right? Go to the doctor and let them know that you got cramps in your hands because you was smashing the like button for me. You know what I'm saying? You're welcome to me and no problem. But like I said, I want to know who you are, where you're from, and where you're at in your nursing journey. A little bit about me. My name is Kevin. I've been an RN, BSN, if that really matters, for almost 4 years. I've worked ICU, OR, and PACU. I was in the Navy for 16 years. Hence, you can't see it. Doesn't matter. But been in the Navy for 16 years, was in the Navy for 16 years, just recently got out in January. 9 of those 16 years, I was a master instructor, taught a bunch of other programs. So I appreciate everybody being here. But we got 1,000 folks. We got 1,000 likes and 100 folks up in here. So let's see what the deal is. Ladies and gentlemen, before we begin, make sure you guys check out the links that I got going on. The link is in my link tree on my bio. You can pre-order my book. You can get a free download, the ebook, join the 7-day NCLEX course for $7. And if you need help with coaching, we'll talk about that as well. But here we go. All right. Question number 1. A 16-year-old patient with cystic fibrosis is admitted with increased shortness of breath and possible pneumonia. Which nursing activity is most important to include in the patient's care? Is it A, perform a postural drainage and chest physiotherapy every 4 hours? Allow the patient to decide whether she needs aerosolized medication. Place the patient in a private room to decrease the risk for further infection. Or is it D, plan activities to allow at least 8 hours of uninterrupted sleep? Void, how are you? What's up? Jessica, I'm an LPN 2017, testing for my RN for the 3rd time soon. Shout out to you. Hey, delayed. Jessica, you're delayed. You are never denied. You see what I'm saying? Hey, we do nothing but spew fucking just niceness out here. And by niceness, I mean, I will positively push you in the right direction to make sure that you conquer this NCLEX. All right. So 3rd time, doesn't matter. Your job will never ask you. Your patient will never ask you. You're good to go. All right. So make sure you go out there and you keep pushing. I know you're going to be able to do it. But we got a bunch of people telling me A. Shout out to all 200 plus of y'all. We're doing NCLEX questions. I got these questions. They're scoured all over the internet. I pulled them from a bunch of places. Some from nurseslabs.com, some from Simple Nursing, some from UWorld, some from Archer, wherever. So you guys, utilize this as much as possible. All right. Hey, and if you pass NCLEX, let me know. Let me know so we can celebrate you. Ashley, I'm in my last semester, graduated in May. Shout out to you, Ashley. But the answer is A, is to perform postural drainage and chest physiotherapy every 4 hours. Airway clearance techniques are critical for patients with cystic fibrosis and should take priority over other activities. The cystic fibrosis transmembrane conductance regulator detects a defect, causes mucus to become dehydrated. Secretions in cystic fibrosis are generally thick, sticky, and more difficult to clear. Frequent airway clearance is the mainstay in the treatment of acute exacerbation, as well as an integral part of health maintenance in cystic fibrosis. Hey, that's part of physiological adaptation. All right, understanding the physiological aspects as well as the disease process and how it affects the body. That is what that is from. Physiological adaptation is 11 to 17% on your NCLEX exam. Is it Harris or Hyris? Thank you for the hi bear. Appreciate you. But hey, understand what this is. It's all about airway. This is airway. You need to be able to understand that. But shout out to everybody that got that question right. Here we go. Question number 2. A patient with a pulmonary embolism is receiving anticoagulation with IV heparin. Paint the picture. What do we think about when we're giving heparin? What is heparin? These are the questions you have to ask yourself in order for you to critically think so you can make a clinical judgment. What instruction would you give the nursing assistant? What instruction would you give the nursing assistant who will help the patient with activities of daily living? Select all that apply. Hey, Miss Lady Amber, I see you. Hey, if y'all don't follow Nurse Amber, what are you really doing out here? Her and I are NCLEX strategists. She is an NCLEX strategist. She's like Mom Bear, and I'm kind of like the more passive aggressive, like, hey, get it done. I ain't got no time to play with y'all. You know what I'm saying? And she's out here doing her thing in these TikTok streets. So if you guys are not following Nurse Amber, what are you doing with your life? We got a collab coming up. So y'all make sure y'all are following both of us out here so y'all can get this knowledge. We're trying to bring the next generation up for you as nurses so y'all can get this knowledge, all right? But select all that apply. So what are we thinking? I saw somebody say bleeding, all right? So bleeding precautions, right? When it comes to heparin, because heparin is an anticoagulant, right? So let us see. Lindsay, thank you for the follow. Appreciate you. All right. Make sure you guys smash that like button. You guys share it and you guys follow. And if you're new here, I want to know who you are, where you're from, and where you are at in your nursing journey. And if you're not a nurse, what are you doing here rocking with us? But all right, here we go. Here's our answer in 3, 2. And the answer is A, B, C, and E. All of the other instructions are appropriate to care for a patient receiving anticoagulants. Risk for bleeding may arise in any condition that disturbs the closed circuit integrity of the circulatory system. Bleeding is the primary complication of anticoagulant therapy and is a risk of all anticoagulants, even when maintained within the usual therapeutic range. So shout out to you, Amber. Love you, Miss Lady. Appreciate the rose. Thank you. Amanda says, I'm from Kentucky, graduate as an RN in 7 months. Shout out to you, Amanda. Hey, speak it into an existence and it shall be so. If you aren't tapping, you're napping. Kim, let them know. Samantha, what's up, Miss Lady? How are you? I see that you're here. All right. So understand that when we do an anticoagulant, it's all about bleeding and also keeping it in a good therapeutic range and what to do when those ranges are out of range. NCRNA school, is that Jenna? Shout out to you, Jenna. You're going to be taking care of folks in a great way. Here comes soon. So shout out to you. Hey, Jenna, let people know how hard CRNA school is so people think that it's not a game, because it's not. Question number 3, a patient with acute respiratory distress syndrome, ARDS, is receiving oxygen by a non-rebreather mask. But arterial blood gas measurements still show poor oxygenation. All right, so paint the picture. We have that mask on them, giving them 100% O2 because that's what a non-rebreather gives. All right, but their oxygenation is still bad. Right. So what do you think? What do you think would happen after that? As the nurse is responsible for this patient's care, you would anticipate a physician order for what action? Perform endotracheal intubation and initiate mechanical ventilation. Immediately begin a continuous positive airway pressure, CPAP, via the patient's nose and mouth. Administer furosemide, 100 milligrams IV push stat, or call a code for respiratory arrest. What are we thinking? We got some A's. We got some B's. Kate, Miss Lady, how are you? Hey, anybody that wants to learn about being an EMT, paramedic, or anything, Medicate, Miss Kate over there will get you right. Trust and believe me. Go, hey, Kate, get them in the right direction. But shout out to all 74 of y'all rocking. We're doing NCLEX questions. Make sure you guys smash that like button. You guys share it and you guys follow. By the way, we're on the road to 10,000 likes. Okay. If I don't get 10,000 likes by the time I get to question 10, my throat hurts. On some Monique Club Shay Shay stuff. You see what I'm saying? Try me if you want, but I appreciate y'all. All right. But the answer is A. It is to perform endotracheal intubation and initiate mechanical ventilation. Remember, I already gave you guys the answer. You meant to say, Jenny, don't be lying out here. Don't be lying. You messed up. You messed up. It's okay. Just admit it. All right. But hey, a non-rebreather mask can deliver nearly 100% oxygen when the patient's oxygenation status does not improve adequately in response to the delivery of oxygen at this high concentration. Refractory hypoxemia is present. Usually at this stage, the patient is working very hard to breathe and may go into respiratory arrest unless healthcare providers intervene with providing intubation and mechanical ventilation to decrease the patient's work of breathing. Also, physiological adaptation, also a management of care type of question. So what is the first thing that we would want to do? What would you anticipate? All right. It says, I just had a similar lab involving this exact scenario. See how important it is, Ashley? You see how important it is? That is why you have to be able to understand, you have to be able to critically think in order for you to make a clinical safe judgment. That's what the exam wants for you to do. All right. So you have to understand that. But shout out to all of y'all who got this right. And if you didn't get it right, circle back. All right. Circle back. It says keep the flow on a non-rebreather for at least 10, please. What are you talking about? Keep that flow on in NRB for at least 10, please. Emma, what you mean? What do you mean? Carl says graduating with my BSN in December. Scared. Why? What you scared for? What you scared for? If you're scared, go to church, Carl. Hey, this could be church for you, but if you're scared, you're going to be scared anyway. The biggest way to alleviate your anxiety of being scared for taking this exam is recreating the testing center, putting yourself on a good time management schedule, and tackling every practice question as if it was your actual exam. All right. Question number 4, a patient with chronic obstructive pulmonary disease. Or a patient has that, with interventions for airway management, should you delegate to the nursing assistant? Now, this is a management of care question, assignment, delegation, supervision. I, as the RN, am delegating something to a UAP or the nursing assistant. What can they do that's within their scope of practice? Okay. Is it A, assisting the patient to sit up to the side of the bed? B, instructing the patient to cough effectively? Teaching the patient to use incentive spirometer, or auscultation of breathing sounds every 4 hours? What are we thinking? Shout out to all 70 y'all out here rocking with me. We are doing NCLEX questions. If you guys are new here, my name is Kevin. I've been an RN for almost 4 years. I worked ICU, specifically a burn ICU and a medical ICU, where I floated to neuro a few times. I also worked in the PACU as well as in the operating room. So that's a little bit about me. I want to know about you, where you're from and where you're at on your nursing journey. But here we go. Here's our answer. Here's our answer in 3, 2. And the answer is A, assisting the patient to sit up on the side of the bed. Assisting patients with positioning and activities of daily living is within the educational preparation and scope of practice of a nursing assistant. Some examples of tasks and aspects of care that can be delegated legally to non-professional, unlicensed assistive nursing personnel provided they are competent in these areas under the direct supervision of the nurse, include assistance with transfers, range of motion, feeding, ambulation, and other tasks such as making beds and assisting with bowel and bladder functions. All right, that is a management of care question. And if you're an LPN, if you are an LPN going to take the NCLEX PN, oh man, I just lost my train of thought. Oh, I'm sorry. But if you're the LPN, it's going to be under coordinated care, which is still the largest section on your NCLEX exam. So RNs, it's management of care. Largest section, PNs, it's coordinating care. All right. So shout out to everybody that got that question right. It says instructing and teaching sounds synonymous. I wouldn't really think about it like that, Jenny, because you're going to start to confuse yourself, or it'll confuse others. Just like teaching, they're the same thing. Maybe. Right. But let's not dive so deep into it, because it's not asking that deep. It's all about how you're conveying instructions of something that is outside of their scope of practice. It says, you know what's funny, at the ER, I'm equal to nurse-ish, but they still ask me, can you do it? Yeah, they can ask you to do it, but it's not within your scope of practice to do specific things. Kate, we talked about that. It says, Andy from Jamaica, been a midwife for 6 years and 3 years in RN school. Shout out to you, Andy. I'm from Jamaica as an LPN. Tammy, shout out to you. Here we go. Question number 5. A patient with sleep apnea has a nursing diagnosis of sleep deprivation related to disrupted sleep cycle. Which action should you delegate to the nursing assistant? Once again, the key word is delegate. Delegate, supervision, assignment, which falls under the client needs categories of management of care. All right. So what would I get as the RN? What would I delegate to my UAP? Discuss weight loss strategies such as diet and exercise with the patient. Would I allow the UAP, or the nursing assistant, to teach the patient how to set up the BiPAP machine before sleep? Would the nursing assistant remind the patient to sleep on his side instead of his back? Or would the nursing assistant administer the modafinil or Provigil to promote daytime wakefulness? All right. When you ask questions or when you state questions that are like that and you put them into your answer, you answer the question before you even get through it. But however, you have to get into the mode of reading your question all the way. You have to read it all the way, and you have to read your answers all the way. I call that RTFQ. Who in the chat can tell me what RTFQ means? China, thank you for the follow. Appreciate you. If you can tell me what RTFQ is, I mean, I'll give you an applause. Shout out to you, right? But you remember, and that's my biggest thing, is that we RTFQ around here. All right. And the answer, read the effing question. Y'all already know what Chelsea, I see you. See, Chelsea didn't think I was going to be here. China, read the full question, whatever. Kim says effing. What is it? Quant says, read the freaking question. Let y'all know what the deal is. Y'all know what the deal is. I don't care what you say as long as you read the question. All right. But the answer is C. Reminds the patient to sleep on his side instead of his back. The nursing assistant can remind the patient about actions that have already been taught by the nurse, specifically the registered nurse, and are part of the patient's plan of care. The right person must be assigned to the right task and job under the certain circumstances. All right. And this is to make sure that they do those things and they're supervised by the nurse. All right. That is also a management of care type of question. Read the forking question. Jenny, really? I'm going to need for you to leave. Come back and try again. Okay. There we go. But appreciate it. I appreciate everybody. Make sure you guys keep smashing that like button. Hey, make sure you guys share. By the way, ladies and gentlemen, if you are new here, I have a free PDF for you. You guys can go over there. You guys can check that out for yourself. It's thebootnurse.com/test. That's 42-page PDF minus that deliciously awesome fanny pack that you see, that melanated man right there that has it. By the way, if you don't have a fanny pack, you should really get one. But 42 pages, free PDF of test taking tips to help you conquer the NCLEX. Why? Because conquering the NCLEX begins with you. Knowledge is power. Make sure you guys go over there and check that out for yourselves. All right. Here we go. Question number 6. If you aren't tapping, you're napping. Kim, let them know what's up. Question number 6. After a change of shift, you are assigned to care for the following patients. Which patient should you assess first? Once again, that is a management of care question. Who do I see first? Priority. Acute versus chronic. Unstable versus stable. Expected versus unexpected. All right. So who would I see first? Would it be a 60-year-old patient on a ventilator for whom a sterile sputum specimen must be sent to lab? Is it a 55-year-old with COPD with a pulse ox reading from the previous shift of 90% O2 sat? Is it a 70-year-old with pneumonia who needs to be started on IV antibiotics? Or is it a 50-year-old with asthma who complains of shortness of breath after using a bronchodilator? What are we thinking? Remember, acute versus chronic, stable versus unstable. Expected versus unexpected. My man Jason, I see you in there, man. I see you. Hey, y'all got me to 10,000 likes, and I appreciate y'all. Now give me to 20. Let's see what's up. If you guys hear my son, don't worry about him. He just woke up from a nap, and he's terrible twosing, and he's a turd. So there's that. We've done this question before, but we've done this question. I better get it right. Hey, you're right. We might have done this one before. Pretty sure we have. Hey, but knowledge is power, right? Giving it to you. All right, y'all, here we go. Here's our answer. Here is our answer in 3, 2. And the answer indeed is D. It is a 50-year-old with asthma who complains of shortness of breath after using a bronchodilator. The patient with asthma did not achieve relief from shortness of breath after using the bronchodilator and is at risk for respiratory complications. This patient needs are urgent. In particular, a patient who is chronically on short-acting beta-2 agonist risks not achieving the same relief from their medication as they once did. The phenomena is called receptor downregulation. It happens because a portion of the receptors targeted end up being inactive by the body due to overuse. That is part of management of care. Yes, sir. You got it right. I'm new here, so I haven't. Ashley, that's cool. Hey, remember, I'm all about meeting people where they are with regards to their education. So just because Jenny's seen it, I know a lot of people haven't. And like I said, even if Jenny's seen it, Jenny probably would have got it wrong because Jenny just thinks she knows everything, and that's okay. But It's all about it's all about repetition and getting that knowledge in. So if you got it right, shout out to you. If you didn't, cool, circle back, understand why these answers are the way that they are, and make sure you read your rationales. RTFQ, RTFR, RTFA. Read the fucking question. Read your fucking answers. And read the fucking rationales. All right, here we go. Question number 7. After the respiratory therapist performs suctioning on a patient who is intubated, the nursing assistant measures vital signs for the patient. Which vital sign value should the nursing assistant report to the registered nurse immediately? So what would I report to a patient? Or what would I report to the nurse? That is like, hey, help, this ain't right. Is it a heart rate of 98 beats per minute, respiratory rate of 24, a blood pressure of 168 over 90, or is it a tympanic temperature of 101.4? What are we thinking? What are we thinking? Shout out to all 67 of y'all out here rocking with me. Hey, we are on the road to 20,000 likes. 20,000 likes, 100 shares, all that good jazz. If you are in nursing school right now and you haven't shared this with anybody in your cohort, I don't care how you feel about them, you're wrong. And I'm going to need for you to fix yourself, because that's just mean. You can't have me all to yourself. You got to share the love. There's plenty of me to go around. Pause. You know what I'm talking about. So what are we thinking? If you guys are new here, welcome. We are doing NCLEX questions. These are both for RNs and LPNs. All right. And I want to know who you are, where you're from, and where you're at in your nursing journey. All right. I'm going to give you 10 more seconds. Jenny, what are you saying facts to? What'd I say? I forgot already. All right, y'all. Here we go. Here's our answer. Here is our answer in 3, 2, and the answer indeed is D. It is a tympanic temperature of 101.4. This patient has a fever, right? So infections are always a threat for the patient receiving mechanical ventilation, right? What is that called? You're not sharing? You better share. Oh, you talking about them not sharing. Okay. So why is it that this patient has an infection? What do we think is happening? The endotracheal tube bypasses the body's normal air filtering mechanisms and provides a direct route or access route to bacteria or viruses to the lower part of the respiratory system. VAP, right? Ventilator assisted or ventilator associated pneumonia, right? Specifically ventilator assisted or associated pneumonia, right? So this patient has having a world of hurt right now because all the nastiness is just hanging out at the base of their lungs, right? Because that's why it's not good for people to be intubated for a long period of time. As somebody that worked in ICU during the second wave of COVID, let me tell you, it happened often because people were intubated for long periods of time. All right. So shout out to everybody that got that question right. If you did not get it right, circle back and understand your management of care type of questions when it comes to delegation, supervision, and assignment. All right. Here we go. An experienced LPN under the supervision of the team leader RN is providing nursing care for a patient with a respiratory problem. Which actions are appropriate to the scope of practice of an experienced LPN? Select all that apply. All right. So you're going to give me more. It's either going to be one, a few of them, or it's going to be all of them. All right. So can an LPN auscultate breath sounds? Can an LPN administer medications via a metered dose inhaler? Can an LPN complete an in-depth admission assessment? Can an LPN initiate the nursing care plan? Or can the LPN evaluate the patient's technique for using the MDIs? What are we thinking? What are we thinking? Shout out to everybody that's out here rocking. We are doing NCLEX questions. Got them. I scoured them from the internet, so they're all over the place. From like UWorld, Archer, some off of nurseslabs.com. I got them from all over the place, right? A few of them I kind of made up. So hopefully you guys like them. You'll never know which one it is, but shout out to y'all. All right. Hey, and here's another thing about me that y'all didn't know. I failed my NCLEX 3 times. Yep, that's right. I failed my NCLEX 3 times, not once, not twice, but 3 times. Shocking, right? So yeah, I failed it 3 times. And you want to know something? No one cares. I don't care, because it doesn't determine the type of nurse that I became. And it definitely won't determine the type of nurse that you will become. The one person that is always in your way is you, and you need to get out of the way when it comes to studying for this exam. All right? This exam does not determine who you are and what you will be. Trust and believe me when I tell you that. I failed 3 times, 2 going for my 4th. That's what I'm talking about. Good times. Good times. Easy credit ripoff. Good. You see what I'm saying? So Kevin, thank you. We love you. Samantha, I appreciate you so much. It says same, still ain't past it. I had to really reread that to make sure that you said still ain't past it. But I'm not here to judge on English. You know what I'm saying, Jenny? But shout out to y'all. Get out of your own way. I don't care how many times you fail. Because guess what? No one's ever going to ask you how many times you fail. They're going to be like, hey, you got a license? There it is. But here we go. But the answer is A and B. Let's get those likes up. Samantha, let them know what's up. All right. So the appropriate decisions relating to the successful assignment of care are accurately based on the needs of the patient, the skills of the staff's position description or job description, the employing of facilities, policies, and procedures, and legal aspects of care, such as the state's legal scope of practice for nurses, nursing assistants, and other members of the care team. So for A, the experienced LPN is capable of gathering data and making observations, including noting breath sounds and performing pulse oximetry. The scope of practice for the licensed practical or vocational nurse will most likely include the legal ability of this nurse to perform data collection, plan, implement, and evaluate care under the direct supervision and guidance of the registered nurse. That's what they can do. Can you evaluate? Yes, but only under the direct supervision of the RN, right? And administering medications, such as those delivered via MDI, is within the scope of practice of the LPN. Based on the basic entry educational preparation differences among these members of the nursing team, care should be assigned according to the level of education of the particular team member. Once again, that is a management of care type of question. What can I delegate to the LPN? All right. What can I delegate to the LPN? So shout out to everybody that got that question right. He said, let's go. That's what I'm talking about. Here we go. Question number 9. The charge nurse is making assignments for the next shift. Oh, I can only guess what type of question that this is. All right. Which patient should be assigned to the fairly new nurse, 6 months of experience, pulled from the surgical unit to the medical unit. So we have a brand new nurse being pulled from their home to a new home. So not only are they new, now they're in a new area. So what patient would I give them? All right. So is it a 58-year-old on airborne precautions for TB, a 68-year-old just returned from bronchoscopy and biopsy, a 72-year-old who needs teaching about the use of the incentive spirometer, or is it a 69-year-old with COPD who is ventilator dependent? What are we thinking? Everybody's telling me, got some people saying C. Denisha told me B. Is that what she said? Yep, she said B. Okay. Samantha's telling me C. Okay. Is it Eliza? That has to be Eliza. Is it Eliza? You're telling me, is it B? Eliza, am I saying that right? He's always crying about something. It's because he's in his terrible twos and he's a brat. So it happened. His birthday's on Friday, by the way. He'll be 2. So Eliza, cool. Got you. Crystal saying C. Okay. I'll give you guys 10 more seconds. Dreamcatcher's telling me B. You're always with me. I am always with you. He says D, though. Okay, I got you. All right, let us see what the answer is. Here we go. Here's our answer in 3, 2. And the answer is C, a 72-year-old who needs teaching about the use of incentive spirometer. Many surgical patients are taught about coughing, deep breathing, and the use of an incentive spirometer pre-operatively. The needs of the client must be competently met with the knowledge, skills, and abilities of the staff to meet these needs. In other words, the nurse who delegates aspects of care to other members of the nursing team must balance the needs of the client with the abilities of those to which the nurse is delegating tasks and the aspects of care. So remember, this is a brand new nurse. In nursing school, you are taught the use of incentive spirometer. And remember, they're coming from the surgical realm to the medical realm. That is something that they understand and that they teach in the surgical realm about the use of the incentive spirometer. Okay, so if I'm taking a brand new nurse with 6 months who worked in surgical to come work in medical, that's something that they should already know. So we want to align those skills up. Okay, hopefully that makes sense. So that's why this answer is C, is because that person, the nurse, that brand new nurse, can teach the 72-year-old the use of an incentive spirometer, right? So shout out to everybody who got that question right. And if you didn't get it right, hey, circle back and get that knowledge so you can better understand it. All right, here we go. Question number 10. The high pressure alarm on a patient's ventilator goes off, okay, when you enter the room to assess the patient who has ARDS. The O2 saturation monitor reads 87% and the patient is struggling to sit up. Which action should you take next? Now, this is, hey, what do I do next? What should I do first? Why? Because I have information inside of my question that's telling me that my patient is in distress. So what do I do next? All right. Do I reassure? The patient at the ventilator will do the work of breathing for them? Do I mechanically ventilate the patient while assessing possible reasons for the high pressure alarm? Do I increase the fraction of inspired oxygen on the ventilator to 100% in preparation for endotracheal suctioning? Or do I insert an oral airway to prevent the patient from biting the endotracheal tube? What are we thinking? All right, everybody's telling me B. I love it. I love it. Shout out to all 64 of y'all. We're doing NCLEX questions. These are both for RNs and LPNs. All right, I scoured them from all over the internet, kind of put them together. All right, this is definitely a management of care type of question, as well as a physiological adaptation for the largest and third largest section on the NCLEX. All right, I want to know who you are, where you're from, where you're at in your nursing journey, as well as you guys like and share and follow. Sharing and liking pushes the TikTok algorithm. A lot of y'all found me on the For You page. I need other people to find me on the For You page. All right. Patient is struggling, cardinal point. Okay. All right. Let's see what the answer is. Let's see what the answer is in 3, 2. And the answer is B. Mechanically ventilate the patient while assessing possible reasons for the high pressure alarm. All right. Manual ventilation of the patient will allow you to deliver FiO2 of 100% to the patient while you attempt to determine the cause of the high pressure alarm. Proper ventilation techniques with the BVM or the bag valve mask should consider safe ventilation parameters for each individual patient and their conditions. Okay. NCLEX in 2 weeks. Shout out to you, just in case. Just in case. I don't know what your real name is, so that's just what I got. Hey, you got this. You got this, all right? You're fully prepared, or you're fully continuing to prepare for your exam, and you're going to go out there and you're going to rock it. Crystal says, I'm from upstate New York. Oh, so you're from Canada? Cool, got you. Graduate my BSN in May. Shout out to you, Crystal. All right, but make sure you guys understand that, hey, if I have a high pressure alarm that's going off, that means that the machine is working too hard to push air. All right, so there's something that's blocking the flow of air from the ventilator to the patient. So that's something that you always have to remember. All right. So shout out to you for getting it right. So here we go. Ladies and gentlemen, real quick. Hey, I have a book, right? It's called Conquering It, The Journey to Passing the NCLEX. This is my journey of telling you how I conquered the NCLEX on my 4th attempt. Why? Because it doesn't matter if you've taken it once or if you've taken it multiple times. I have been in that position and I understand what it's like where you want to give up and where you feel like you're a failure. But the one thing that we are not around here is we are not failures. We are champions and we will conquer. And trust and believe me, I don't do quitters around here. I don't do quitters. It's okay for you to fail, but it's not okay for you to quit. So you guys can go over there, check that out. It's in pre-order right now. It's going to be fully launched on June 5th, which is my 4-year anniversary of being a nurse, right? You can check it out at thebootnurse.com/books. Hey, remember, like I said, the journey to conquering the NCLEX begins with you, and it was like that for me. So make sure you guys go over there and check that out. All right, here we go. Question number 11. The nursing assistant tells you that a patient who is receiving oxygen at a flow rate of 6 liters per minute by nasal cannula is complaining of nasal passage discomfort. Okay, what intervention should you suggest to improve the patient's comfort from this problem? Is it A, suggest that the patient's oxygen be humidified? Suggest that a simple face mask be used instead of the nasal cannula. Suggest that the patient be provided an extra pillow, or suggest that the patient sit up in a chair at the bedside. What are we thinking? Shout out to all 64 of y'all. We're doing NCLEX questions. All right. If you guys were at Nurse Amber's live, make sure you guys get over there and you guys get that knowledge. Make sure you guys follow both of us because her and I are going to be doing a collab here real soon. And you guys are going to love it. You're going to get the two brilliant minds. All right. Good cop, bad cop, but two brilliant minds when it comes to NCLEX. If you guys don't know her story, she failed her NCLEX too. She failed her NCLEX. That's okay if you fail it. What's not okay is that you just tell me that you quit and you give up and you don't want to do it anymore. That just tells me that you want your dream to continue to be a dream and you don't want it to be a reality. And we want you to have your reality. All right. But let's see what the answer is. Everybody's telling me B's and A's. So let's see. Here we go in 3, 2, and the answer is A. Suggest that the patient's oxygen be humidified. Why? Let's figure it out. When the oxygen flow rate is higher than 4 liters per minute, the mucous membranes can be dried out. The best treatment is to add humidification to the oxygen delivery system. It is reasonable to use humidified oxygen for patients who receive high flow oxygen systems for more than 24 hours, or who report upper airway discomfort due to dryness. Application of a water-soluble jelly to the nares can also help decrease mucosal irritation. None of the other options will treat that problem, okay? So shout out to y'all for getting that question right. Physiological adaptation, all right? One of those, not medical emergencies, but hey, what is the next step in the care that I would take care of with regards to this patient, all right? And it says, Yeppy, am trying today. You're trying what today? What are we doing today? So shout out to y'all. But here we go. Question number 12. When a patient with TB is being prepared for discharge, okay, which statement by the patient indicates the need for further teaching? So I'm discharging my patient. My patient said something that was incorrect. That was not part of the teaching, or they misunderstood me. How do we correct that? Okay. The patient stated, everyone in my family needs to go and see the doctor to be tested for TB. Does that require further teaching? I don't know. I will continue to take my ionized until I am feeling completely well. Does that require further teaching? I will cover my nose and mouth when I sneeze or cough and put my used tissue into a plastic bag. Does that require further teaching? I will change my diet to include more foods rich in iron, if you're from Baltimore, protein and vitamin C. Does that require further teaching? What are we thinking? What are we thinking? Hey, if you guys are new here, welcome. My name is Kevin. I am one of the best, if not the best, NCLEX coach out here on these TikTok streets. That's my shade to Amber if she's still listening. But I've been a nurse for almost 4 years. I work ICU, OR, and PACU. I was in the Navy for 16 years. Last 9 of my 16, I was a master instructor, and I'm here to teach you how to get through your NCLEX. If you have any questions, comments, or concerns, drop them down here in the chat. But I want to know who you are, where you're from, and where you're at on your nursing journey. What are we thinking? What are we thinking? What are we thinking? Dreamcatcher, appreciate the share. But let's see what the answer is in 3, 2. And the answer is B. I will continue to take my ionized until I am feeling completely well. Patients taking ionized must continue the drug for 6 months. The other 3 treatments are accurate and indicate an understanding. Not treatments. The other 3 statements are accurate and indicate an understanding of TB. Drug of choice is ionized or Inizid. I keep saying ionized, but y'all know what I'm talking about. It is usually given with vitamin B6. Peroxidine, which is to prevent nerve damage. Inizid is recommended for the Maddox or quantiferin positive individuals and should be continued for 6 to 9 months. All right. So shout out to y'all who got that question right. If you did not get that question right, hey, go understand TB. That's part of physiological adaptation, which is the 3rd largest section on your NCLEX exam at 11 to 17%. Okay, 11 to 17%. So make sure you guys go over there and check that out. All right, here we go. Question 13. To improve respiratory status, which medication should be prepared to administer to the newborn with respiratory distress syndrome? All right, is it theophylline, surfactant, dexamethasone, or albuterol? What do we think it is? Kiki tells me C. Geraldine, there you go. See, I knew you pop up in here. I'm pretty sure you've been in here for a while. So Crystal's telling me C. Vicky is telling me C. Cool. All right. What else are we thinking? What else are we thinking out here? Hey, we're on the road to 20,000 likes. And make sure y'all smash that like button. Make sure you guys share and make sure you guys follow. That is the trifecta that TikTok needs. That is the trifecta that TikTok needs for me to be in front in the For You page. Why? Because I'm for you. I'm for all y'all. Well, everyone that needs it. But here we go. Here's our answer in 3, 2. Is it Nana? Thank you for the share. Appreciate you. It's B, surfactant. Exosurf neonatal is a form of synthetic surfactant. And in an infant with respiratory distress syndrome may be given 2 or 4 doses during the first 24 to 48 hours after birth. It improves respiratory status, and research has shown a significant decrease in the incidence of pneumothorax when it is administered. All right. This is a pharmacological and parenteral therapy type of question. All right. Understanding, hey, this is surfactant. This is a medication that we give to a patient that's having respiratory distress syndrome. All right. So understand PHARM. PHARM is 13 to 19% on the NCLEX, and it is the 2nd largest section on your NCLEX exam. Even though it's the 2nd largest, by far, pharmacology is the hardest. That's my opinion. You can agree to disagree, whatever. But I'm telling you right now, pharmacology is a monster. It is a monster of a section, and it's all about making yourself familiar about the families and what they do. Okay, so shout out to everybody that got that question right. All right, here we go on to the next one, just in case it says agreed. There you go. Here we go. Question 14. The clinical instructor directed the student nurse to care for a client whose potassium is 6.7. All right, cool. Which intervention is delegated correctly to the student nurse? Okay, now let's think about that. All right. I have a level of potassium at 6.7. Is that good or is that bad? Now, I have to think to myself, what can I delegate to the student nurse? Remember, the student, understand the scope of practice. Understand the scope of practice, right? Who can do what? And as the RN, the RN who is the clinical instructor, what can I delegate to a student? Okay, is it to give potassium? All right, 10 milliequivalents orally, give a sodium or give K-exolate 15 milligrams orally, give spironolactone 15 milligrams orally, or assess the ECG strip for tall P waves. What are we thinking? What are we thinking? Let's answer it a different way. Would I let a student nurse give 10 milliequivalents of potassium? Would I let them give 15 grams of K-exolate? Would I let them give spironolactone 15 milligrams? Or I'm sorry, 25 milligrams. Or do I want them to assess the ECG? I want you to think about that. Think about that. Everybody's telling me D. Okay. Got some D's. We got some B's out there. All right, let's see what the answer is. Let us see what the answer is. As a matter of fact, well, no, we're not going to see what the answer is. I want you to really read this. Is this potassium right here, is that good or bad? Let's answer that. Is that good or is that bad? Crystal, thank you for the share and the like. Is that good or is that bad? That's bad. Correct. This is bad, right? Now, if this is bad, right, and I have a student nurse, it doesn't say what year that they're in. It doesn't say anything like that, right? What are some things? What would I give to a student? What would I do? What would I allow the student nurse to do? This is high, right? So what can the student nurse do to help lower this? Remember their scope of practice. There's some things that they're not proficient at. Okay? They can't assess. Oh, ECG. So like understand like what can they do and what can't they do, right? What can they do and what can't they do? Now, let's see. Here we go. It's B. Kiki's telling me it's B. Okay, well, let's see. Somebody's telling me it's D. Let's see what it is. And the answer is B. It is that they can give K-exolate 15 milligrams orally. All right. Now, let us see why they can do that. All right. Delegation. Supervision. The normal range for potassium is 3.5 to 5 milliequivalents per liter. The client's potassium is high. We stated that. K-exolate eliminates potassium from the body through the GI tract. Okay? The right person must be assigned to the right task and job under the certain circumstances. The nurse who assigns the task and job must then communicate with and direct the person doing the job or task. Right? So the whole point is we want to reduce the patient's potassium level. I want you to think about that. What is the likelihood that a student nurse can accurately assess an EKG strip? Right? Think about that. And that's where it says think about the scope of practice. I didn't become proficient at learning EKGs proficiently until I started working in the ICU. The patient is unstable, so the student can't assess. There you go, right? Very slim. Caramel, it's very slim. I can't, Ashley says I can't, right? Is what I meant. Oh, the patient is unstable, so the student can't assess is what you meant. Okay, I'm tracking that, right? So you have to understand who can do what, and that still has to do with delegation to students as well, okay? So can they give something orally to lower the potassium? Absolutely they can. Would I want them to give potassium? No, because it's going to make their potassium go higher. Why would I do that? Well, why would I do that? I would not want to do that. Okay. So shout out to everybody that got that question right. Make sure you understand this is where your critical thinking comes into play in order for you to make a safe clinical judgment. Okay. Because I can tell you right now on NCLEX, that's what they want. They want you to make a clinical judgment, a safe one. All right. And giving them, having them assess a EKG and also having them give potassium. No. That's a no. We don't want that. All right. Question 15. The patient with COPD has a nursing diagnosis of ineffective breathing patterns. Which is an appropriate action to delegate to the experienced LPN under your supervision, meaning under your supervision as the RN? Okay, so once again, this is a delegation question that falls under management of care. Okay, so can the LPN observe how well the patient performs pursed lip breathing? Can they plan a nursing care regimen that gradually increases activity and tolerance? Can they assist the patient with basic activities of daily living? Can the LPN consult with the physical therapy department about reconditioning exercises? Can they do it? What are we thinking? Now, think about this. Think about it. Understand with delegations of who can do what. Also think about the UAP. What can the UAP do? Because if the UAP can do it, the LPN doesn't need to do it. All right, think about that. This is where I want you to understand. The RN can do everything that the LPN and the UAP can do, right? But the whole point of delegation is to work smoother, right? So if I see something that is not involved with that specific individual, there's no need for them to do it, right? So let's see what the answer is. I wonder how many of y'all changed your answers after I said that, but here we go in 3, 2. And the answer is A, observe how well the patient performs pursed lip breathing, right? Experienced LPNs, LVNs can use observation of patients to gather data regarding how well patients perform interventions that have already been taught. The scope of practice for the licensed practical or vocational nurse will most likely include the legal ability of this nurse to perform data collection, planning, implement, and evaluation care under the direct supervision and guidance of the registered nurse. So how many of y'all changed y'all answers after I explained it the way I just explained it? And how many of y'all feel that was a good explanation for you to go forward to read your question, to read your answers? Yeah, that's okay. Admit it. I would rather you get it wrong here than you get it wrong on your exam. You know what I'm saying? Vicky, shout out to you with the handshakes, right? So you have to understand when it comes to delegation, it's still who can do what. Just because I'm the registered nurse, can I do activities of daily living? Absolutely. But is it my job to do the activities of daily living that require me to be doing something else? No, I can give that to somebody. I give that to somebody else that's a part of my team, right? Everybody is an intricate part of the machine. Okay. Good evening, Sherry. Good evening to you. Shout out to you, Jessica. All right. So make sure you guys understand your management of care. This is the largest section. All right. Ladies and gentlemen, I have an NCLEX course. And if anybody ever asks me, what do they recommend for an NCLEX course? My NCLEX course. All right. I have over 70 videos in there right now, and I'm actually going to be uploading 9 videos from the cardiology section that are going to go in there to help you conquer I have 2 NCLEX reviews in there. One that breaks down the NCLEX test plan, and another one that is it's 100 questions where I go through for the next generation or the new generation NCLEX. And you can join that right now for $7. You can get it for $7 for 7 days, and then it goes into a subscription for $97. But you also get a community where I go live once or twice a week, where I go through lectures as well as I break down NCLEX style questions. You guys can get your questions answered. You guys can jump in, all different types of stuff. It's kind of like TikTok, but it's a lot more involved and a lot more engaged. So you guys can go over there and check that out. It's for a limited time. It's going to go away soon. So make sure you guys jump into that, especially if you're on the road to conquering your NCLEX. All right, thebootnurse.com/special, or you guys can check that link out in my bio. All right, tap. Let them know, Ashley. Question number 16. When assessing a 22-year-old patient who required emergency surgery and multiple transfusions 3 days ago, you find that the client looks anxious and has labored respirations at the rate of 38 breaths per minute. The oxygen saturation is 90% with the oxygen delivery of 9 liters per minute via nasal cannula. Which action is appropriate? Now, is there enough information in here for me to just start implementing? Probably. They gave us all the information that we ever could want. So now we need to do something. All right. We need to do something. Now, do I want to increase the flow rate of oxygen to 10 liters and reassess the patient after about 10 minutes? Do I want to assist the patient in using the incentive spirometer and splint the chest with a pillow while he coughs? Do I want to administer or order morphine sulfate to the patient to decrease his anxiety and reduce the hyperventilation? Or do I want to switch the patient to a non-rebreather mask at 95% to 100% O2 and call the physician to discuss the patient's status? What are we thinking? What are we thinking? Everybody's telling me D. D. Throw some D's on it. Claire is telling me D. Claire, when I see your name, it reminds me of Claire's, like the store. I don't know why. I feel like you have the face to be at that store. I don't know why. But shout out to all y'all rocking. We're doing NCLEX questions. All right. If you guys are new here, make sure you guys share. Make sure you guys like. Make sure you guys follow. That is the trifecta to getting in front of the TikTok For You page. All right. And also, I want to know who you are. If you're new here, I want to know who you are, where you're from, and where you were at in your nursing journey. And if you're not a nurse, what are you doing here rocking with us here on this Wednesday? Man, the week goes by fast, y'all. The week goes by so fast. But the answer is D. Switch the patient to a non-rebreather mask at 95% to 100% O2 or oxygen and call the physician to address the patient's status. The patient's history and symptoms suggests the development of ARDS, which will require intubation and mechanical ventilation. Patients are mechanically ventilated, guarded against fluid overload with diuretics, and given nutritional support until evidence of improvement is observed. All right. This is part of physiological adaptation. All right. As well as what is the very first thing that you should do. If TikTok shuts down, will you do these on Instagram? I'll do these on Instagram. I'm going to do these. I'm going to do them on YouTube. Also, I do these inside of my NCLEX course. So I'm going to be doing them more frequently inside of the NCLEX course. That's the most 100% guaranteed place where it's going to be. So, but yeah, most definitely, if TikTok shuts down, that's exactly where I'm going. I'm going to Instagram and I'm going to go to YouTube. So never fear. Kevin will still be here. All right. So make sure as you guys are understanding these questions, you circle back and understand what these questions are asking you. Remember RTFQ, RTFA, and RTFR. All right, here we go. Question number 17. Which of these medication orders from or for a patient with pulmonary embolism is more important to clarify with the prescribing physician before administration? It says, got to find you on Instagram. My Instagram is everything is at the boot nurse. Everything. YouTube, Facebook, Instagram, TikTok, everything is at the boot nurse. To include, you go to my website, thebootnurse.com. Down at the bottom, you'll see the tabs that'll take you to Instagram as well. All right. So is it warfarin or Coumadin at 1.0 grams by mouth? Is it morphine sulfate, 2 to 4 milligrams IV? Keflex at 250 milligrams PO, or is it heparin infusion at 900 units per hour? What are we thinking? So who can tell me what the problem is? What's the problem in this? What's the problem? And but with regards to the question and the answer, what is the problem that we are looking for? The trailing zero. Crystal, look at you. Crystal, she's so smart out here. All right. We're looking for something that is incorrect. Abbreviations, right? We're looking for those things that could cause an error. Clarification. There it is. And the answer indeed is A. It is A, because what did Crystal say? She said the use of trailing zeros is not appropriate when writing medication orders because the order can easily be mistaken for a larger dose, such as 10 milligrams. Imagine giving somebody 10 milligrams of warfarin. They're going to be a bleeding catastrophe out here. All right. It says, I have to take a blood thinner, so that's how I know. That's cheating, Samantha. That's cheating. No, I'm just kidding. But you have to understand about your trailing zeros. I'll give you an example. I had a physician put in something about 20 milligrams or 2 milligrams of insulin. And I'm like, hold up, what? So that ain't good. Go ahead and give somebody 20 milligrams or 2 milligrams of insulin and see what happens. Because insulin is not measured in milligrams, it's measured in units. So you have to be very careful. By the way, when you are ever taking an order, and if you ever need clarification, you better call the doctor. You better never, ever, ever give a medication blindly to anyone ever. Ever. If you don't know what it is, if you've never seen it before, you better start asking questions before you give it. Trust and believe me when I tell you that, because that is your license that's on the line. All right. Even though you don't have a license yet, my goal is to make sure you get it and you keep it until you're ready to retire. All right. Here we go. Question 18. You are acting as a preceptor for a newly graduated RN during her second week of orientation. You would assign the new RN under your supervision to provide care to which patients select all that apply. Would it be a 38-year-old with moderate persistent asthma awaiting discharge, a 63-year-old with a tracheostomy needing trach care every shift, a 56-year-old with lung cancer who just undergone left lower lobectomy, or is it a 49-year-old just admitted with a new diagnosis of esophageal cancer? What would it be? Remember, it's a select all that applies. So it could be one, it could be few, or it could be all of them. It's rarely ever one, and it's rarely ever all of them. Just saying. We got B and D. We got A and B. Shout out to everybody that's just now joining. We're doing NCLEX questions. These are both for RNs and LPNs. If you're an LPN, going to take the LPN exam, you need to know what you can and cannot do and what you can and cannot accept. That is the biggest difference between LPN and RN NCLEX. All right. But guess what, LPNs? You learn the same exact content that we as RNs learn. All right. And trust me, when you bridge, you're going to be like, I already know this. Of course, you already know it. You learned it while you were in LPN school. All right. But the answer are A and B. OK, so for a patient who is awaiting discharge may be stable enough for the care of the nursing student. I don't ever do this. Hold on a second. Not the nursing student, but for the nursing student or for the new grad. Right. Or for the new nurse. The client is the center of care. All right. So, and for B, the new RN is at the early point in their orientation. The most appropriate patient to assign to her are those in stable conditions who require routine care. In other words, the nurse who delegates aspects of care to other members of the nursing care team must balance the needs of the clients and with the abilities of those in which the nurse is delegating tasks and aspects of care, among other things such as scope of practice and policies and procedures within the particular healthcare facility. So shout out to everybody that got that right. If you did not get it right, listen, ladies and gentlemen, you have to read your rationales. You have to read your rationales. You have to. You have to. All right. Because reading your rationales allows for you to retain the information that you have not only gotten from your content, but what you have received in regards to reading your questions and your answers. All right, here we go. Question number 19. Jenna is a nurse from the med-surg unit of a tertiary hospital. Okay. She was asked to float on the orthopedic in which she has no prior experience working on. Which client should be assigned to her? So once again, management of care. All right. So somebody who's never worked on a floor is getting floated to a floor that they've never worked on before. So what type of patient would I give them? What type of patient would I give them? You guys, we've been doing these all pretty much the whole time. So which ones will we give them? All right. Is it a client with a cast for a fractured femur and who has numbness and discoloration of the toes? Is it a client with a balanced skeletal traction and needs assistance with morning care? A client who had an above the knee amputation yesterday and currently has a temperature of 101.4? Or is it a client who had a total hip replacement 2 days ago and needs blood glucose monitoring? What are we thinking? Remember, there's still those basic things that nurses could do. What are the basics that nurses could do? All right. Something that I would give to this patient. What type of patient can I give this floating nurse? I think we've already stated that before, right? So once you do enough of these, it becomes old news. There's that, like the NCLEX can't throw really crazy things at you. All right. We're on the road to 20,000. Hey, get carpal tunnel for me right now. Hey, we're almost to question 20. If I don't have 20,000 likes by the time I get to question 20, which is the next question, I might just turn in for the night. You know what I'm saying? Because, I got things to do. I got things to do out here. Banana says D. Well, let's see what the answer is. Here we go in 3, 2. And the answer is D. A client who had a total hip replacement 2 days ago and needs blood glucose monitoring. A nurse from the medical surgical floor floated to the orthopedic unit should be given clients with a stable condition as those who have care similar to her training and experience. A client who is in a postoperative state is more likely to be in a stable condition. All right. That is part of management of care because this is talking about delegation and assignment. Who am I going to give this nurse floating to my unit? What patient am I going to give her or him or whatever you identify as? Apache helicopter. Anyways, so shout out to y'all for getting that correct. All right. And understand management of care. Once you go through enough questions, it makes sense. Okay. Understand critical thinking in order for you to make a clinical judgment. All right. Question number 20. Which intervention by a patient with a pulmonary embolus can be delegated to the LPN on your care team? All right. So let's think about this. What is a pulmonary embolism? Right. And what, with regards to a pulmonary embolism, what can the LPN do? All right. Can the LPN evaluate the patient's complaint of chest pain? Can the LPN monitor lab values for changes in oxygenation? Can the LPN assess for symptoms of respiratory failure? Can the LPN auscultate the lungs for crackles? And this is me asking you these questions. And this is a technique where that you can use, especially when you know it's a management of care type of question. This is a technique that you can use while you're taking your exam or while you're studying. I recommend using it. That's my freebie to y'all. Why? Because I love y'all. All right, what are we thinking? Everybody's telling me D. All right. Hey, if you guys are new here, welcome. We're doing NCLEX questions. These are both for RNs and LPNs. Make sure you guys smash that like button, you guys share, and you guys follow. My name is Kevin. I am a nurse, an RN specifically. Been a nurse for 4 years almost. Worked ICU, OR, and PACU. So happy that everybody is here. All right, hold on. TikTok ain't letting me be great, y'all. I swear it asks me every time, are you still here? Does this look like Netflix? The hell? Anyway, so the answer is D, auscultating the lungs for crackles. An LPN who has been trained to auscultate lung sounds can gather data by routine assessment and observation under the supervision of the RN. It is well within the scope of practice of the LPN to auscultate lung sounds. Because if they hear crackles, who are they going to go tell? Me. They're going to come tell me, the RN. Because that is the next step in their chain. Just like me, if I hear auscultations in the lungs, I'm going to be calling the doctor, being like, "Hey, I hear crackles in the lungs. I think we need to get a diuretic so we can pull the fluid off the lungs." They're gonna be like, "Yeah, cool, we'll do that." Took my NCLEX PN today, just waiting for my results. But I'm talking about Ashley, Nurse Ashley, putting it into existence, and it shall be so. All right. Hey, I'm pretty sure. I have no doubt that you conquered that exam and you did the best that you could. So I'm speaking into existence right now. Let me be the first to tell you congratulations. Welcome to being a nurse. Welcome to the shit show. And then on Friday, I want you to come back and officially tell us that you are now a nurse, Miss Lady. But ladies and gentlemen, if you're one of those individuals who's failed your NCLEX multiple times, if you're one of those individuals who just doesn't know where to start, you have problems with understanding NCLEX style questions, whether it be RN or LPN, if you don't understand or have good time management, lack accountability, want somebody to really be all up in your face to make sure that you're getting this done, putting you on a schedule. If that's something that you're looking for, I do coaching. I coach all the time. I've been coaching for almost 4 years. I have a 100% pass rate. Everybody that I coach, they pass, every single one of them. All right. And if that's something that you're looking forward to doing or looking to do because you just don't know what to do or where to go, check me out, thebootnurse.com/coaching, fill out the questionnaire, book a call with me, and let's see if coaching is right for you. Why? Because coaching is a relationship. And I want to make sure that our relationship is good because the biggest thing, my job is one thing and one thing only with my coaching. It is to mentor you and to get you a license, period. All right. So shout out to all of y'all. Make sure you guys go over there and check that out for yourself. It says this is my second time testing. That's cool, Ashley. I've took my exam 4 times. So I don't know what you want me to say. It's your second time. Guess what, Ashley? You know who's not going to ask you? Your patient and your job. That test won't determine what type of nurse that you're going to be. Only you can do that. All right. So now you learn what you learn. So shout out to you. Here we go. Question 21. The nurse plans care for a client in the post-anesthesia care unit. All right. Also known as the recovery room or PACU, right? Which of the following should the nurse assess first? Is it respiratory status, level of consciousness, level of pain, or reflexes and movement of the extremities? What are we thinking? Paint the picture. Post-anesthesia, meaning they're coming from somewhere like the OR or a procedural room where they essentially were put to sleep and they had a tube in their throat. What is the very first thing that I want to do as the nurse? What am I looking for? What am I assessing? What do I need to gather more data on? These are the questions that you need to ask yourself as you are answering these questions, all right? Once you get into the routine, I'm telling you, you're going to fly through them. You're going to fly through them, all right? Everybody's telling me A. Well, let's see what the answer is. The answer indeed is A. It is the respiratory status. Assessing respiratory status is the first priority. Remember your ABCs. Also remember your level of consciousness, okay? Level of consciousness goes hand in hand with ABCs, okay? General anesthesia and mechanical ventilation impair pulmonary function even in normal individuals and result in decreased oxygenation in the post-anesthesia period. They also cause a reduction in functional residual capacity of up to 50% of the pre-anesthesia value. Listen to me. The last thing you ever want to do is to go to the PACU and hear somebody go, "Ah!" Trust me. When you hear it, it's like the hair stand up on your back, and you're just like, "Who in the hell is losing their airway over there?" That is important. That is important. That is important. Respiratory status is the most important thing to think about when they are coming from a procedure or they're coming from the operating room. All right, especially when they're under general anesthesia, because that's what it's from. So make sure you guys understand that. By the way, that was Strider that I just made. So Strider, upper airway obstruction. All right, here we go. Question 22. Nurse Jackie is reviewing the diet of a 28-year-old female who reports several months of intermittent abdominal pain, abdominal bloating, and flatulence. The nurse should tell the client to avoid what? So, which one of these foods should be avoided with regards to bloating, abdominal pain, and, the flatulence, the passings of the gases? What are we thinking? Is it fiber, broccoli, yogurt, or simple carbohydrates? Shout out to all 66 of y'all. We are doing NCLEX questions. If you are new here, make sure you guys like, share, and follow. My name is Kevin. I am a registered nurse, been one for almost 4 years, worked ICU, OR, and PACU. And I am an NCLEX coach. And I've been coaching people for almost 4 years. So if you are one of those individuals that has stumbled upon my life, make sure you guys like, share, and follow. Get this knowledge. All right. Everybody's telling me C. Is it Lilo? What's up? I ain't seen you in a while. How are you? Queen says broccoli. Oh, first one to drop the emoji of the broccoli. I appreciate you, Queen. Here we go. Here's our answer in 3, 2. And the answer is B. No, Chelsea. You took too long. To answer. Your answer doesn't count. All right. Broccoli is known to be gas forming, which can lead to bloating and therefore should be avoided. In general, gassy food. Oh my God. Hey, Gel, how you doing? Hey, y'all, Gel's here. Hey. So, yeah, guys, just avoid broccoli, okay? Jeez. Anyways, that's part of basic care and comfort. Stop it. Yes, Miss Lady. That's what I'm talking about. Y'all, Gel took her NCLEX the other day, right? And I was giving her crap about it, but I told her to come back. Ma'am, first of all, congratulations to you. Welcome to the greatest shit show on earth. You already know what the deal is. I'm proud of you. I appreciate you for just taking all the jabs that I give you. But if I didn't like you, I wouldn't do it. But congratulations to you. Welcome to the shit show. If there's a piece of advice that you could give to everybody out here, what would it be? And once again, congratulations to you. Welcome to nursing. All right, now that I'm done with that, I have to go back to being myself. Hey, y'all, Gel is here. Oh, my God. All right, but anyways, broccoli. Broccoli, ladies and gentlemen, it causes the fart. Stay away from it, all right? Here we go. Question number 23. The nurse is planning care for a client who had undergone a colposcopy, right? You sick of me? You lying. If you was sick of me, you wouldn't have came back here, okay? Stop playing. All right, which of the following actions should the RN take first? So what is the very first thing? All right, this is telling me that this is a management of care question, right? Prioritization. Which one of these do I do first? Do I discuss the client's fears regarding potential cervical cancer, assist with silver nitrate application to the cervix to control bleeding? Do I give instructions regarding douching and sexual relations, or do I administer pain medications? What are we thinking? E, give the patient broccoli. Jana, if y'all don't know who hey, y'all see where it says emo nurse practitioner? She's one of the homies. She's my Bessie with the Tessie, right? So, nurse practitioner, one of the best mentors that I ever had when I was working ICU. So I love her, Jana. But don't be coming in here giving wrong answers. You know better. All right. So what do we think the answer is, y'all? What do we think the answer? Oh, my God. Really? Really, Jana? Oh, my God. Here we go. Everybody's telling me, we got some people saying D. Some other people saying, what else did you guys say? You got B. I saw somebody say up there. Got an A. Okay. All right. All right. Geraldine is telling me D. All right. Another one's telling me D. Okay. All right. ARNMD. So you're a registered nurse medical doctor. Shout out to you. Bria is telling me D. All right. Kiki's telling me C. Is it Quant? Is that how you say your name? Quant? I want to make sure I'm saying that right. Quant is telling me B. But let's see what the answer is in 3, 2, and the answer is B. It says, Kevin, you should record and put your lives on YouTube. Lilo, what are you talking about? Have you not been to my YouTube? That's where my lives go. So it says to control bleeding. That's exactly. Okay, Quant. I want to make sure. Yay. Shout out to you, Queen, for getting it right. So colposcopies is a procedure to examine the cervix, vagina, and vulva for signs of disease. The priority nursing action when caring for a client who underwent a colposcopy is to assist in controlling potential bleeding by applying silver nitrate to the cervix. So that is what that is for, part of your ABCs, right? So make sure you understand why you got it right. And if you didn't get it right, look at your answers. Look at the answers to understand why those answers are incorrect. But we're still talking about ABCs, airway breathing, but that is part of circulation because this person just came from having a procedure. And if you don't know what a colposcopy is, hey, look it up. Get the knowledge of understanding the pathophysiology of that. I was going to put B, but I switched it. Look at you. Look at you. All right. Hey, usually your first answer is your correct answer. All right. So never switch it unless you can articulate to me why you're changing it. Don't you ever change it. I want you to pretend like there's a little me standing on your shoulder. I want to be like, Bria, what are you doing? You changing the answer? Why? You better not change that damn answer. All right, cool. As long as we got that understood, right? Got to stop second guess. Yes, Sherry, you have got to stop second guessing yourself. All right. You got to stop doing it. All right. Go with your gut answer. Question number 24. Sally is a nurse working in the emergency department and receives a client after a radiological accident. All right. Which task is the priority for the nurse to do first? Okay. This is another management of care type of question. What is the very first thing that I should do for what do they call it? Like an NBC, a chemical, biological, nuclear, biological, and chemical type of accident or warfare, right? So they're covered in this stuff, right? So what do I want to do? I want to decontaminate the clothing. Do I want to decontaminate the open wound of the client's thigh, decontaminate the examination room the client is placed in, or save the patient's vomitus for analysis by the radiation safety staff? What are we thinking? Remember, when these things happen, they can affect a lot, right? Not just the patient, but they can affect what's going on inside of the areas that you work. But read the question. You have to read the question first. So everybody's telling me, we have some people saying A, we got a B. Okay. Queen is telling me A. Vicky is telling me A. Claire's telling me A. Okay. Open wound care. Okay. Jenny is telling me A. Jenny. I'm sorry, I'm going to leave. Here we go. But the answer is B, is to decontaminate the open wound of the client's thigh. All right. Let's see why. Let us see why. Decontaminating an open wound is the first priority for this client. This minimizes the absorption of radiation in the client's body. The radiological accident is an event that involves the release of potentially dangerous radioactive materials into the environment. This release is usually in the form of a cloud or plume and can affect the health and safety of anyone in its path. One really good example to think about with regards to that is when they dropped the nuclear, bombs on, 2 Japanese cities. If you didn't die from the initial aspect of what happened, it was it was a radiation fallout that took people out after that. So that's essentially the same concept. So biggest thing is that you want to make sure that these people are decontaminated before they go into any type of facility. All right. So get rid of them clothes, decontaminate them, scrub, and then you can do something else with them as I'm moving them into a facility. Let's hope we don't ever have to deal with that. But it's a really good example to think about. All right, here we go. Question number 25. The nurse is caring for 4 clients and is preparing to do his initial rounds. So which client should the nurse assess first? Once again, this seems like a management of care type of question. Y'all get me to 30,000 likes. And then we can find out what this answer is, all right? But is it A, A client with diabetes being discharged today. Does that require my attention right here, right now? Maybe. Is it a 35-year-old with a tracheostomy and copious secretions? Does that require my attention right now? What is this answer telling me? Okay, he's have a tracheostomy. So is that an airway issue? Yeah. Copious secretions. Do we want that? Probably not. We'll hold on to that. Right? Is it a teenager scheduled for physical therapy this morning? Is that emergent? Does that require my attention right here, right now? Probably not. Or is it a 78-year-old female with a pressure ulcer that needs a dressing change? Does that need to be taken care of right now? No. Do I need to take care of that? Absolutely, I need to take care of that, right? So due to process of elimination, our answer would be B, right? Because why? The patient with an airway problem should be given the highest priority. The ABCs identify the airway, breathing, and cardiovascular status of the patient as the highest of all priorities in that sequential order. All right. Tracheostomy, airway, secretions. That's an airway. We don't want to have aspirations, right? Exactly. Banana. It says, who's gonna die if I don't see them first? And the very first person that would die would be the tracheostomy that has copious secretions. All right. So shout out to y'all who got that right. That is a management of care type question. Remember, management of care. Or if you're an LPN taking the LPN exam, coordinating care, they are the largest sections on the NCLEX exam. You'll see it where it says 15 to 21, 15 to 23, 18 to 23. It does not matter. You just need to know that they are the largest sections on the exam. So the bulk of your questions will come from them. All right. So shout out to everybody that got that right. And ladies and gentlemen, that is a wrap. That is a wrap on the questions for tonight. I appreciate y'all getting me to 26,000 likes. Hey, give me to 30,000 likes. Hey, give me 30,000 likes right now. Make it happen. All right. I appreciate y'all participating. I appreciate all the love. I appreciate all the likes. I appreciate the gifts. While they are not required, they are surely appreciated, because when you guys give the gifts and when you guys give the likes, it pushes the algorithm to the For You page for the people that need it. All right. Once again, I do get questions from nurseslabs.com. You guys can go over there and check those out. But I did not get those questions from nurses. I got some, but not all of them. But you guys can go over there and check those out. I got these all scattered all over the internet, right? 7-day NCLEX course. You can be a part of that. You can be a part of that course and that community for $7. All right. You mean to tell me you'd rather go buy Starbies? Girl, stop playing. But anyways, you guys can check that out. That's at thebootnurse.com/special. There's also a free download over there. You guys can also check out Conquer It, which is my book that is in pre-order right now. Also, you guys can check, if you guys are looking for coaching for NCLEX, you guys can check that out at thebootnurse.com/coaching. All right. So, hey, so I'm going to hang out, right? I'm going to hang out right now. But what questions do you guys have? What questions do you guys have? If you guys are just now joining, my name is Kevin. I've been a nurse for almost 4 years. I worked ICU, I worked OR, I worked PACU. I was in the Navy for 16 years. I failed my NCLEX 3 times and I passed on the 4th. So what? So what? When people fail their exams, they're so worried about what other people are going to think about them. Let me tell you something right now. None of them people care. None of them people care, let alone none of those people know, because you didn't tell them. I tell people all the time I failed my exam. I've had people flat out tell me, you failed your exam. I would never want you as my nurse. Cool. Less shit I got to deal with. You see what I'm saying? But I'm going to tell you right now, if somebody's dying, totally different story. Totally different story. You see what I'm saying? Nurse 74, hello, Kev. Just watch and listen tonight. You're doing a great job. Ma'am, thank you so much. I appreciate that. Mary Blessed, you're awesome. No, you're awesome. I appreciate you being here. Thank you guys for the likes. April, thank you. I appreciate you being here. But what questions do you guys have? You guys have questions about NCLEX? You guys have questions about nursing school, how to get into nursing school, how to get through it? Like, your first year as a nurse, imposter syndrome. You guys think about entrepreneurship. Do you guys think about entrepreneurship with regards to your skills of learning as a nurse, like, other things that you can do as a nurse, stuff like that. It says, how soon can you take the NCLEX after you graduate? I graduated in May with my ADN. So that all depends on once you get your authorization and test back from Pearson VUE. Because once you graduate, your school sends your transcripts and everything to your board of nursing. The board of nursing sends your stuff to Pearson VUE. Pearson VUE, or the board of nursing, is like good to go. Pearson VUE is like good to go. Then they send you your authorization to test, and then you can schedule your exam. So that could be 5 days. I've seen it as early as like 5 days to as late as like 4 to 6 weeks. So it all really just depends. But once you get your authorization to test, you can schedule it as early as you want. You can schedule it as early as you want. So, it all just depends on you. It says, bow tie questions, what is the best way? Oh, so what is the best way to tackle your bow tie questions? The best way to tackle your bow tie questions is truly to understand what that question is asking you. I don't have any examples up here in front of me, but the best way is to understand, like, because it's going to ask you, like, what do you think the disease process is? Is it a myocardial infarction? Is it a pulmonary embolism? So you need to be able to determine when the question is asking you something from the information out of the case study, what is going to be your answer, right? And let's say, okay, it's a myocardial infarction. What do you need to do with regards to taking care of a patient with myocardial infarction, right? Do we need to draw the cardiac markers like our troponin, right? Or our KC, our CK kinase, right? Or do we need to give nitroglycerin, O2 saturation, or O2, right? On an EKG monitor, right? A referral to cardiology. Like those are those things. That's how you use your critical thinking in order for you to make a clinical judgment. Like, what am I going to do right now based off of the disease process that's given to me? And then what are we going to do to monitor their care later on? All right. It says, thank you. It says, you're getting me through my last semester. Hey, look. Hey, is it Anna Lynn? Hey, I'm glad I'm getting you through it. I'm glad something is working for you. And if it's working for you, hey, who am I to take that away? I might take it away. I'm just kidding. But shout out to you. You're going to rock it when you graduate and when you go take your exam. Vicky says, what advice will you give to a new grad who intends working in post-op unit or ICU? My advice to you is to be a sponge, take as many notes as you can, ask as many questions as you can, and advocate for yourself. If you don't know something, say it. If they're trying to push you to do something that you're uncomfortable with or you've never been trained in doing, say it. Because remember, this is your license. And if something happens to a patient, the Board of Nursing does not care what somebody told you. The Board of Nursing does not care what your hospital's policy is. They're going to ask you, what was your license? What is your scope of practice? So if you didn't know it, you should have said something or you shouldn't accept it. All right. So that will be my advice to you, is to be a sponge. You're going to go through imposter syndrome at some point to where you're going to be like, I shouldn't have done this. Maybe I shouldn't have been a nurse. That's a part of that's a part of the growth process. And you have to absorb that. Okay. Is it Nadja? Nadja says, where do I start as a new LPN? As in, like, where do you go and work? Vicky, you're welcome. It says, where do I start as a new LPN? Like, as in a job, you can start anywhere. You can start at a hospital. You can start at a clinic. You can start at a long-term care facility, nursing home, wherever. It all just depends on where you want to go. You can, like a lot of the LPNs I know, they work at the hospital. I know some that I coach personally. Like one of them, she works in pediatrics right now. She lives in Dallas and she's loving her life working in peds, taking care of babies. So you can work just about anywhere. It all just depends on what those hospitals will allow for you, or what those hospitals where they want you to work. So is it Cristal, like the champagne says, I need help in pharm too. So the biggest thing about pharmacology is I call it the umbrella effect, understanding where everything falls under. So if I have cardiac medications, I need to know what all cardiac medications fall under that umbrella. So what? ACE inhibitors, ARBs, beta blockers, calcium channel blockers, digoxin, nitroglycerin or your nitrates, your diuretics, your anticoags and your antiplatelets, right? And I need to understand, well, number one, what those look like. So I know my beta blockers. All my beta blockers are LOLs, and I know all my LOLs are beta blockers, right? And then once I understand that, I need to understand, what do beta blockers do? Do they decrease blood pressure? Do they decrease heart rate, right? Do they decrease the preload and afterload, relaxing the heart, right? What medication would that be used for? Like, I would give a beta blocker for somebody who's having a AAA because there's so much pressure that's happening inside of the aorta, right? Because of like coronary artery disease. And then once you understand that aspect, understand the safety aspects. Like, when do I give this medication? When do I not give this medication? When I do give this medication, what is the expected and unexpected outcomes, right? That is the sequence of how you want to learn them, right? So I like using cardiac meds because that's a really good example, but you can do the same thing with respiratory meds, GI medications, psych medications, so on and so forth. Crystal, you are welcome. Crystal, not Crystal, but Crystal says, how do you feel about getting a temporary practice permit after graduation? Everybody gets one. Everybody gets one. I think it's great if you have a temporary license because it puts you in practice. That way, right when you get your license, it's an easy transition. Literally, it goes from they change your status from GN to RN or GN to LPN or whatever it is. I think it's a good thing, because it allows you to get out there and allows you to practice. Now, the only thing that sucks about that is that if you don't do well on the NCLEX and you're unsuccessful, that temporary license will expire. Because it expires, I believe, 90 days after you graduate. So it'll expire. So that means you can't work there anymore, and you would have to get your license before you can go back and work. So I think it's okay. I think it's not a bad thing. They've been doing it for I don't know how long. So. But that was a really good question. Christelle, that was a really good question that you asked as well. So, hey, if you guys are new here, welcome. We did NCLEX questions for both RNs and LPNs. I got those questions from all over the place. I would recommend if you are going to look for good sets of questions, just like Nurse Amber, she likes UWorld, I like Archer. So we kind of met in the middle. So we talk about both UWorld and Archer. If you're looking for an NCLEX course to get you through one, I got you on one. I have 70 videos that are in there right now on top of, I'm adding 9 videos this week for the cardiology section of the important things you need to know for RNs or LPNs, doesn't matter. And you guys can check that link out in my bio as well. It says, that is my fear, failing and losing the temporary license and a job. Crystal. So your fear of failing, you're going to lose a job. And your license, regardless, you're going to lose that temporary license anyway. Either you're going to pass and you're going to have your license, or you're going to fail and the license is going to expire and you can't use it anyway, right? But here's the thing: is you can get a job anywhere, and I truly, truly mean that. Like, I understand. The fear is real. The fear is real, and I'm not going to take that emotion away from you. However, we have to conquer that fear, and you really have to understand that where one door closes, another one will open. Okay. So if you fail, you fail. But what we want to do is speak those words of affirmation, right? Put it out into the universe, put it out into the universe. It'll give it back to you. If it's positive, and it shall be so. All right. So don't even say that. I have a fear of failing. Don't say, I will not fail. I will be a nurse. I will not fail. I will have my license. I will not fail. I will be working as a nurse. You have to put those positive words of aspiration out there into the universe in order for them to give it back to you. I have failed 5 times and I'm so discouraged. So, Aveline, the one thing I'm going to tell you is if you're scared, go to church. And number 2 is, when are you taking it your 6th time? And I'm going to be completely honest with all of you, is that if you fail, I give people some leeway, but if you failed more than twice, it's your fault. Yours. It's your fault. Because there's something that you are not learning. Could it be that you aren't studying effectively? What does your time management look like? What does your study plan look like? Are you accountable? Are you studying effectively? I have people tell me, Kevin, I study for 4 to 6 hours. Okay. So is that consecutive or is it throughout the day? Well, I'll study 10 questions here and then 20 questions. And I'm like, No. We need to get some consistency here. And that's what happens, is that you have this thought process of what you think you know, but in reality, you don't know what you're doing. And that's okay. That was me. I didn't know what I was doing, and it took a mentor for me to find that. It took a mentor to literally cut out all this noise that's out here, because that's exactly what it is. Somebody's going to be like, oh my God, girl, use UWorld, it worked for me. Oh my God, girl, use Archer, it worked for me. Use Hearst, use Kaplan, blah, blah, blah. That's all you need. Maybe that's not all you need. I'm just saying. Maybe that's not all you need. I'm keeping it a stack, as the kids say, right? They're like, maybe that's not all you need. Maybe you need one-on-one, hand-holding or mentoring. Maybe you need that. I do that as well. You can check that link out in my bio, right? And I meet you where you are, because you'd be so surprised on what people don't know. I had somebody reach out to me and say, hey, what are peripheral pulses? And I'm like, I'm sorry. What are peripheral pulses? Some people have been out of school for quite some time and haven't passed the NCLEX, and they forget. So you have to meet people where they are. So you have to realize, where are you having a deficit? Like, what are you not understanding? The very first place I'm going to tell you to start is your CPR, is your candidate performance report. And it's going to show you. Here's the great thing about being unsuccessful at the exam is that now you have data. It's going to show you where you didn't do well on, and then when you're going forward, what you can improve on. Mary says, thank you for your positive words. Listen, this is all I can, I gain nothing. I gain nothing from lying to anybody about the reality of what this exam is. I've had people come up to me that was like, hey, all you need is this. Hey, nah, bro, all you need is that, not me. Hey, all you need is the book. Bro, forget that book. You put a book in front of me, I'm falling asleep. So what type of learner are you? That's another thing. What type of learner are you? Are you auditory? Are you kinesthetic? Are you visual? Are you a read write? Are you one of those people that can sit there and read a book and just be like, eating whatever little croissant you got from Starbucks and drinking your frap or whatever and taking notes? Can you do that? Cool. Not me. Not I. Not a lot of people. All right. So now you need to figure out what you need to do for yourself. User 27 gives me the hugs. Shout out to you. I mean, virtual. Not the book. I'm trying to tell you. And here's the thing. When I coach you, I am not a book reader. There's plenty of information out here in this world to include inside of my course for me to give you to where it'll give you all the information that you need in order for you to pass your NCLEX. And here's another thing I want to say is that NCLEX, you are not meant to be perfect. You're not supposed to know everything, because even if you knew everything, the NCLEX is going to pull out some wild shit that you're going to be like, what is that? Who is that for? Because it ain't for me. Now realize when they start pulling out very hard questions, that means you're doing very well. And that's where the goal is to get to the hard questions. That's what the goal is. Okay. And that's what we talk about, right? In the coaching, we break down NCLEX style questions. I was on a phone call with a young lady yesterday for an hour and a half. By the time we get to the hour and a half mark, she is gassed. She's just like, I get it. And she's like, man, I'm so tired. And I was just like, see? I was like, but do you understand what we are talking about? And that's the whole point, is to give you that personal one-on-one to make sure that you're understanding the content and applying it to your questions so you can make a clinical judgment. That's what the NCLEX test plan says. That's what it says. All right. So shout out to all y'all. Not the book. Yep. I don't believe in the book at all. If you guys are just now joining, my name is Kevin. I'm a registered nurse. I'm an NCLEX coach. I've been a nurse for almost 4 years. I worked ICU, OR, and PACU. We did NCLEX questions at 5:30 Central Standard Time. And if you missed that, make sure you guys are liking. Make sure you guys follow me. Turn that notification button on. Also, follow me on Instagram. Follow me on YouTube. Everything is at the Boot Nurse. And because we don't know what's going to be happening in these TikTok streets. But there's one thing I can guarantee you is that I will always be doing something somewhere, right? I can guarantee you that 100% it will always be inside of the 7-day NCLEX course community, where we go through lives, we break down questions, as well as, we have a community over there where, those same people going through the same struggles that you're going through. All right. And the thing is to pass the NCLEX. All right. So what other questions do you guys have? It says, I'm still here after passing the NCLEX. You're still here after passing the NCLEX? That's what I'm talking about. You want to know why? Is because some people, here's the one thing I don't ever want anybody to be, is I really don't want you to be selfish. But a lot of people are very selfish. They're just like, fuck it, I studied for it. Y'all got to figure it out. I'm out here by myself. But the true gift of wealth is creating service for others. Like me teaching, me being on here consistently on TikTok, and me teaching privately, me creating a course for everybody that's out there. Like it is not a passion. It is an obsession at this point. And it is me doing research, me reading all these boring ass, long ass documents that are needed for y'all and to create stuff for y'all so y'all can get that in. It's weird. Like I enjoy doing it because I want to continue to be a service. I think that's probably stems from my military background. From me being in the Navy for 16 years is, you do things that are bigger than yourself. When people join the military, no matter how small you are an intricate piece of a big machine when it comes to providing freedom and democracy, whatever you guys want to call it, to other people, to include the country that we live in. So my continued service, or what one of my friends would call my second service, is to provide as many things as I possibly can to my people out here. What's up, Kate? I see you out there, girl. Is there a wait list for your coaching? So currently right now, I have one spot available for my coaching. Usually I only take about 5 to 6 people a month. Why? Because it allows for me to not be spread so thin, number one. And number two, it allows for me to give you all that I have when it comes to understanding what's going on with you so you can progress forward. I have one of my students who's taken her NCLEX on Friday after she was unsuccessful, I think once or twice, and I know that she's going to kill it. I'm speaking it into existence truly right now that she will be an RN. Trust and believe me, she will be one. So, but if you're, is it Alvine or Alvine? Hopefully I said that right. If you're looking for coaching, check the link out in my bio. You'll see the link tree, and then in the link tree you'll see where it says 7-day NCLEX. It'll say NCLEX coaching and mentoring. Click on that. That'll take you to where to my page where you can fill out a questionnaire, all that good stuff. And then we'll see if coaching is right for you. All right. It says, what's the cost per month? So the cost per month for what, Nadja? For what exactly? But I'll show you what that looks like right now. Hold on, let's do this. All right. So if you are one of those individuals, this is what my link tree looks like. If you're one of those individuals, I know my screen is dirty, y'all. Don't be judging me. All right, we making it work out here. So if you go to my link tree, you can pre-order my book, which is coming out in June. That tab's right there. If you want a free download, that's right there as well. I have an ebook that's for $29. It's over 700 pages that you guys can check out. If you're looking to join the 7-day NCLEX course, you can join that right now for only $7 by joining. And then at the bottom, I have the NCLEX coaching and mentoring at the bottom as well. It says I already purchased. You already purchased what? I'm confused. You got me lost. It says, how come you're skipping my question? I'm not skipping your question. Your question's not popping up. So you're either asking something that the algorithm's not liking. So I'm not skipping your question. It's just not popping up. So Nadja, you're asking for a question. Oh, for one-on-one. So for one-on-ones, it differs. Some people need a lot, and some people need less. So they're custom packages per person, and not everybody has the same package. So so that's how that is with regards to that. So like I said, if you're looking for coaching and if that's something that you're interested in, you as well can go to the link in my bio and fill out the questionnaire, and then go and schedule a call with me, and then we can see what one-on-one specifically that you need. Alvine, you said you purchased what? I'm confused. What did you purchase? And by the way, if you guys are new here, welcome. We did NCLEX questions. It says most affordable coaching price I've seen. Who is that? That has to be somebody. Who is that? Liz, what are we talking about? It says, I completed the questionnaire. So if you completed the questionnaire, there was a button that was right at the end that said schedule a call with me. If you didn't schedule a call, then obviously we won't be able to talk other than, like right here. So, or you should have received an email, with regards to that. And if you didn't, then, it says $7, 7 days is for $7. So it's an on-demand course, and it is $7 for you to have it for 7 days. After 7 days, it will go to a subscription. It will go to $97 per month, for you to have it. But like I said, you'll have access to the course. You'll have access to the NCLEX reviews. You'll also have access to the community, which is where I do live lectures as well, and I do Q&A in there as well. So it's gonna be a good fun time. And also, there's a way for you to earn possibly getting a free coaching call with me if you do some of the challenges that are inside of the community. All right. So make sure you guys go over there and check that out. What other questions do you guys have? If you guys are just now joining, we did NCLEX questions. We do them every Monday, Wednesday, Friday, and 5:30. What is better? What are you talking about? What do you mean, what is better? I don't know exactly what you mean. So, but yes, like I said, I've been coaching people for what? Like I said, it'll be almost 4 years. Almost 4 years. I had already had an extensive teaching background before I became a nurse. So I decided to implement that with helping people pass the NCLEX because, that was a very big struggle for me. And I never want anybody to feel how I felt. I don't ever want them to feel like they were a failure and they couldn't accomplish this. And that's exactly why I do what I do. Can you tell us more about the NCLEX Victory Guide? So the NCLEX Victory Guide it's an ebook, and it's over 700 pages, like 780. Like I went extremely overkill with that. But inside of the NCLEX Victory Guide is everything from growth and development to pharmacology, a lot of pharmacology. There's management, delegation, and assignment type of questions that are in there, and essentially everything that you would need to know in order for you to conquer the NCLEX. I mean, it's for $29. $29, and you get over, like I said, it's like 700 pages of just craziness, right? But all the pertinent things that you would need to know for the NCLEX. It says $7 for 7 days or $97. Where do you get the most info? No, so it's the same thing. So it's the $7 for 7 days is a trial. So, like if you want it for $7 and you want it for 7 days, and then after 7 days you don't want it, then you can cancel your subscription. But if you don't cancel your subscription, it's automatically after the 7 days going to charge you $97, and you're going to have it for a month, right? So it's $97 a month. There is no other option as of right now. This is a deal that I have going on because at some point the $7 for 7 days is not going to be there, and it's just going to be $97 a month. So this is just a way for you to go and check it out. Tell me if you like it, if it's helpful, leave me a testimony, go in there and get you some knowledge. And then, like I said, you get the community as well. Do you like being a part of the community where we do lives? Do you like the challenges with your chance of getting, another free PDF on top of getting a one-on-one NCLEX coaching and mentoring session with me? So the link, if you're looking for the 7-day NCLEX course, you can tap my little face up here, right? And then you'll tap my little face again, and the link will be inside the link tree, and then it'll be labeled as join 7-day NCLEX course for $7. It'll be in that link. It'll be inside of my link tree, and the link tree will look like that, minus all the specs and stuff that are on my computer, right? So this is what it'll look like. Like I said, it'll be my not my victory guide, but this is my book that's coming out, a free download. If you want 42 pages of ways to help you tackle the NCLEX, the ebook, of course, joining the 7-day NCLEX course right here, and then the coaching and the mentoring aspect. As a matter of fact, do you want to see what the course looks like? I can show you what the course looks like. If you want to see what the course looks like, just let me know, and I'll pull it up right now. That way you guys can see what is inside the course and what, essentially like what you're going to be getting. Let me know. Y'all let me know what y'all want to do while I hang out here for another few minutes. But what other questions do you guys have? What other questions do you guys have with regards to with regards to NCLEX, nursing, or anything like that? What questions do we got? All right, let's see if this pulls this up. All right, well, you know what? Regardless, I'll show you anyway. So we'll do this. All right, so right here is what the NCLEX, this is what's inside the 7-day NCLEX course. So towards the left are all of the lectures, right? So towards the left are all the lectures. This is the very first page that you guys are going to see where it says, welcome to the 7-day NCLEX course, right? And then it tells you that there's over 70 plus videos that are in there right now. And like I said, that number is going to keep growing over time. I have it predicted where I'm going to have well over 150 videos in here, content videos, as well as reviews to help you guys in here. So towards the left, it says, does the RN program teach ACLS and PALS like medics? No, it does not. It does not. It teaches BLS because not everybody needs ACLS and not everybody needs PALS. So it all just depends on where you work. But everybody will have BLS, that's for sure. So on the left side, we have all the lectures, right? So the very first thing, I do it like telling a story. Some people did not know and don't know what the NCLEX is. We have a lot of foreign nurses that come here and they're just like, what exactly is that? So I give you the information way from the beginning, right? And then after you get all that pertinent information, we jump right into the review, right? So the very first one we go over is management of care, right? With management of care, we jump right into questions, right? I tell you what is inside, like what are the client needs categories. So where they would pull their questions from and how they create their questions. And then we jump right into questions. right? The exact same way on how I do it here. You guys get it on demand, but you guys get more thoroughly made type of questions. All right. And with this is a review. You go through, you take notes, you understand, you listen, you participate for yourself, right? So this is an on-demand NCLEX review for yourself, right? So I have management of care. All of my videos are less than 30 minutes. Some of them. I think this one's like 37, so it just made me a liar, right? So here. So there's that one. And then, of course, like what I have, pharmacological and parenteral therapies. That's where we go over pharm questions, physiological adaptation, reduction of risk potential, so on and so forth. And then it ends with psychosocial integrity. And then I'm making another video currently right now, what to expect on NCLEX Day. All right. Then I have another one where we go through the new generation NCLEX review, right? Well, I have a new generation NCLEX review, right? Where we go through case studies in these questions. These are randomized questions. These are randomized questions. I'm pretty sure this looks familiar to all of you, right? Where look at those, like look at these boxes. Bring that over here so you guys can see a little bit, right? So, and we answer these questions. We go through rationales. We read them, tell you why they're right, tell you why they're wrong, right? And look at that case study information, right? And then over here towards the left. So that's what the review is. And then over here towards the left again, if you guys can see, we go through, I have content. Look, here's pharmacology, the second largest section on the NCLEX, and I have 18 videos where I want to actually put more videos over here, and I'm working on those as well, right? And so fluid and electrolyte balances, cardiology, I'm adding like 9 videos to this right here, 9. Endocrine system, talk about DKA, hypoglycemia, DI versus SIADH, so on and so forth, right? And so that's what the course, the on-demand course does. Now, if you want to look at the community, this is what that looks like. Click on that button like so, and it takes you to the NCLEX community if my internet decides it wants to work, right? So when you join the NCLEX community, you get to be a part of this, right? And so we start here towards the left. We have our, we have our introduction. So I want you to introduce yourself, right? When you first come in there, share your wins. So anybody that passes NCLEX, right? So this is everybody seeing AJ, right? Where he passes wins, right? We have Donovan, who used the 7-day NCLEX course after failing on his first attempt. He used the course, it helped him out, and he passed. It passed, right? And so I don't care what your wins are. I don't care if you're doing well on tests. I don't care anything. Like, share your wins, because that way you're in a group with positive people that are going to push you in the right direction. And then, of course, there's a general discussion, right, where we talk about specific things like, hey, I told everybody what I was updating and what I had going on, right? Tomorrow is your NCLEX. Oh, well, I'm glad tomorrow is your NCLEX. I'm glad you weren't here for when I did my questions, right? But hey, you have prepared properly. You're going to go and you're going to rock that exam. All right. So you get a many prayers going out to you for you to go out there and do your thing. All right. So right here, I have challenges where I do NCLEX questions every week. Right. And so somebody who does these NCLEX questions, you answer the questions, right? And then it'll randomly pick a winner. Once we pick that winner gets something special from me. All right. And then down here, I have a monthly challenge where we do ECG or EKG interpretations. Right now, we have 4 days left on this heart rhythm right here. And y'all have to tell me what that is. And I'm pretty sure people are like, oh my God, I know what it is. I know what it is. Right. Well, hey, if you know what it is, come over to the community and tell me what it is. Right. And so once you're able to tell, hey, and the winner of that gets a one-on-one session with me. And so like, this is part of the community. And by the way, and also we do meetups, right? So tomorrow I'm doing a meetup, or we're doing a live lecture in here where we're going to be going through more NCLEX style questions. You get to watch the recorded versions, right? Up here top, I did psychosocial integrity, maternal health, pediatrics, motivational Mondays, fundamentals, right? So we added videos up in here on top of the videos that are already inside of the on-demand NCLEX course. So you get that course as well as the community, right? And by the way, you message me on that community, you get message back, right? It's like, so it's like, I use those as my priority, because those are telling me about the people that are really out here that are trying to do better for themselves. Not saying anything about TikTok, because I love all y'all, but those people get my attention as well. So that is what is inside the NCLEX course, all right, for everybody that was asking about it. But what other questions do you guys have? You guys hear my son? He's saying no, or oh no. He's a trip, y'all. He's a trip. All right. So what else are we thinking? What other questions do you guys have? All right. Well, hey, if you guys don't have any other questions for me, I'm going to wrap it up. Make sure you guys take care of yourself. All right. There's only one. You only got one you. All right. Don't allow the stress of this exam that has no emotional tie to you whatsoever. Allow for it to dictate the type of person that you're going to become or the type of nurse that you're going to become, because it does not. Only you determine the type of nurse that you're going to be. No NCLEX exam, no other nurse can ever do that. All right. So make sure you guys check out what I got going on. Check out my link tree in my bio. Make sure you guys follow me on YouTube and Instagram in case we don't know what's going on with the good old TikToks, right? Make sure you guys check out the 7-day NCLEX course. Make sure if you guys are looking for coaching, or if you guys are looking for something one-on-one where we can get you over that hump to pass NCLEX, you guys can check out the NCLEX coaching and mentoring. Look, I'm here for y'all. I do this specifically because I'm trying to get people. I'm trying to be a huge determining factor for the next generation of nurses. Like, I want to be that dude where people are just like, he helped me pass. That's what I want. That's my service, my second service to y'all. Do you do lives every day? No, I do them Monday, Wednesday, and Friday at 5:30. And as a matter of fact, I'm probably going to decrease maybe one of my days. And I'm actually going to add it inside of my my community, right? I know Chelsea, if she was here, she might be here lurking. She's like, no, don't do it. Well, Chelsea, you know the deal. You know what's up, right? So, like I said, make sure you guys be a part of that and you guys check that out, okay? And that's pretty much it. If you guys don't have any other questions, I'm going to wrap it up. I hope everybody has a good rest of their week. Make sure you guys follow me, you guys subscribe, and hit that notification button so you guys know when I go live, so you guys can get these NCLEX questions and all this knowledge. Can you look at my CPR and make a plan for me? I can do that with regards to, you have to fill out your questionnaire and book a call with me, and we can see what's up. It says, will you be on this Good Friday? Yes. It all just depends. I have a bunch of errands and stuff to run around that day. So, it all really just depends on what's going on that day. But I still plan on being on Friday for sure. So, but yeah, you guys take care, and I will see everybody later.